Loss of bladder control, known as urinary incontinence, is a major problem affecting people of all ages. It is especially common amongst people living in residential aged care facilities, affecting over 70% of residents. If the residents' incontinence issues are managed effectively through a continence care plan, it can have a positive effect on the resident's physical, psychological, and social well-being. To identify the appropriate care plan and funding requirements for a resident with incontinence, the aged care facility conducts a manual continence assessment. This requires a carer to manually check, every 2 to 3 hours, the resident's pad to determine the level of incontinence. This practice is labour-intensive, inaccurate, has poor compliance, and is disruptive to the resident. Simavita now has the solution, replacing a manual continence assessment process with a medical device called SIM. SIM technology enables a carer to remotely monitor and assess incontinence events. At the heart of this innovation is a SIM sensor embedded into a continence aid worn by a resident. The sensor is connected to a transceiver called a SIM pod. This links them into the facility's wireless SIM network. From within the network, a central data processing hub called the SIM station runs the SIM management software. This software includes sophisticated patented algorithms that continuously monitors data from the sensor and records individual voiding patterns. The information is used to generate a SIM chart. The SIM chart provides 2 reports. The bladder report gathers detail on the number of wetness events. The events report records observations, for example, pad changes, behaviours, and fluid intake during the assessment period. The information from these reports is used to produce a SIM plan, providing the carer with an efficient toileting schedule and appropriate continence aid selection. The goal is to provide a definitive person-centred continence care plan. SIM provides considerable labour savings by enabling the carers to monitor the continence status of each resident in real time on a computer or by SIM phone. To capture these savings, a financial report can be generated showing labour savings from the SIM assessment, continence aid savings, savings achieved from an effective toileting schedule, and environmental waste savings. These savings are the result of implementing SIM in the residential aged care facility. In a real-time comparison between a SIM assessment and a manual assessment, you can see the difference. The manual assessment process is based on carers physically checking the resident's continence aid every 2 to 3 hours. The more frequent the carer checks residents' bladder elimination and urinary continence status, the more effective the bladder report will be. However, the frequency of checks is not always possible, as it interferes with the resident's usual activities and can be embarrassing for the carer and resident. In a SIM assessment, less time is needed to check the continence aid, as this is done wirelessly. This gives the carer more time to spend with the resident. SIM completes the continence management cycle and fills in the missing critical factors. SIM validates, increases compliance, and provides accurate and reliable continence assessments without disruption to the resident. SIM puts science behind why certain continence aids should be selected and allows carers to accurately assess the proper use of continence aids. SIM drives an effective toileting schedule that is individualized to the resident's continence needs. SIM gives staff the knowledge and confidence to develop a definitive person-centered continence care plan. Simavita's motto is gracing life. SIM provides a sense of dignity and grace to those with incontinence.